Room check. My patient is at my table. This is the camera stand. This is my patient cervix start. Start the video.
Hi,
Wash my hand. Hi Bella, how are you?
I'm good. How are you?
Good. My name is Lee Nguyen. I'm the nurse practitioner student. Today I'm going to conduct the cardiovascular and pulmonary exam. Before we begin, I just want to ask for your permission so I can ask for the medical history, and also I'm going to conduct the physical exam including listening, touching, and doing some tests with you. Is that okay?
Yes.
And for the training and education purpose, I'm gonna record this visit. Is that okay to you?
Yes.
Okay, thank you. So, first of all, I'm gonna read Bella's blood pressure when she's laying down on the left and the right side, and then have Bella sitting up, wait for 5 minutes, and then take the blood pressure again on the left and the right side. I'm not doing this in this video, but I'm gonna put the result in the documentation. Alright, Bella, now I'm gonna have you lay back on the examiner table. I'm gonna raise the examiner table 45 degrees, and I'm gonna check for the jugular venous pressure. Make sure make yourself comfortable, okay? Let me fix it, the pillow for you. Alright. Your back feel okay?
Yeah.
Alright, hand down. Okay, that's okay?
Yeah.
To check for the JVP, I'm gonna have you to look to your left slightly. Yeah, and I'm gonna check for the pulsation. When I see the pulsation, and then I'm gonna look for the highest point of the pulsation. Then I'm gonna mark that. This pen, and then I'm gonna look for the sternal notch. I'm gonna use the ruler to measure. So the JVP is 3 centimeter when the head of the bed raised 45 degrees. Next, I'm gonna inspect the carotid bilaterally. Can you look for the left, the left for me, please? I appreciate the carotid pulsation, symmetrical, bilaterally, no abscess lesion, no swelling, edema. And then I'm gonna palpate for the right carotid artery. I appreciate the carotid artery pulsation is uphold brisk, the contour is smooth, +2 on the right. I'm gonna palpate for the carotid artery on the left. I appreciate the carotid artery pulsation, uphold brisk, the contour is smooth, +2. Then I'm gonna auscultate for the carotid artery bilaterally with the diaphragm first. And I'm gonna listen with the bell of the thermostat. I don't appreciate any fluid murmur over the carotid arteries bilaterally. Now I'm gonna go to inspect the chest wall. I appreciate the chest wall is symmetrical, no deformity, no visible abnormal finding. Now I'm gonna inspect for the apical pose. I'm gonna have Bella to lay on her back. Since Bella is a woman, so I'm gonna have her to display the breast tissue to look for the apical pose. Due to clothing, I don't appreciate any apical pose. I'm gonna palpate for the apical pose over the chest wall. And I'm gonna have Bella to display her breast tissue when palpating. I appreciate the apical pose at the fifth intercostal space, mid-clavicular line. And then I'm gonna observe for the precordial pose. Due to clothing, I don't appreciate any precordial pose. Then I'm gonna check for the point of maximal impulses. For the PMI, I'm gonna palpate over the chest wall and also have Bella to lay on her left side. I appreciate the PMI at the fifth intercostal space, mid-clavicular line. It's at the same point with the apical pose. And then I'm gonna have you lay on your back. Thank you. I'm gonna palpate over the chest wall. I don't appreciate any frills, hips or lips. Now I'm gonna palpate for the abdominal aorta. I'm gonna look for the umbilicus, and the abdominal aorta is about 5 centimeters above the umbilicus. I'm gonna deep palpation. You may feel some pressure, but there should be no sharp pain. If you have pain, let me know, okay? Any pain? I don't appreciate any abdominal aorta position. And I'm trying to identify the abdominal aorta. I appreciate the diameter of the abdominal aorta is about 3 centimeters. Then I'm gonna use my stethoscope to listen for the heart sound over the chest wall. Starting with the diaphragm of my stethoscope at the aortic area, second interspace on the right, subclavicular. At the pulmonary area, second intercostal space, subclavicular on the right. The earth point about the third intercostal space next to the sternum. The tricuspid area about the fourth intercostal space. Next to the left of the mid-clavicular line, and then the mitral area about the fifth intercostal space, mid-clavicular line. With the diaphragm, I appreciate the physiologic S1 and S2 at the auscultatory areas. I don't appreciate any extra abnormal heart sound. I don't appreciate any heart murmur. Then I'm gonna use the bell of the stethoscope to listen for all the auscultatory area at the aortic area, pulmonary area, earth point, tricuspid area, and mitral area. I don't appreciate any fluid. Then I'm gonna listen to the abdominal aorta with the diaphragm. Then listen with the bell. I don't appreciate any fluid. Since I have Bella laying down, I'm gonna also check for her femoral vein bilaterally. I appreciate the femoral artery pulsation +2 normal rhythm bilaterally. And then I'm gonna listen to the femoral artery with the diaphragm. And then with the bell of the third slot. I don't appreciate any fluid over the femoral artery bilaterally. Okay, now I'm gonna change Bella's position. I'm gonna have you sitting up straight, and I'm gonna move the camera. To make sure I have the good view. I'm gonna have Bella sitting on the chair right here. Right here. Okay. Now I'm gonna have you take a big deep breath. I'm gonna listen for the physiology splitting up S2 at pulmonary area when Bella take a deep breath. Now take a deep breath deeply for me, please. Here. Now you can breathe normal. I appreciate the physiology splitting up S2 at the pulmonary area when Bella inhale. The physiologic splitting of S2 to A2 and P2 is better when Bella inhale because of the lower venous resistance over the pulmonary artery. Delay the systolic contract of the heart. And also I'm gonna inspect the overall skin and feet to make sure there's no. So we're gonna move you right here. I appreciate the color of the skin is appropriate with anexity, pink flushing, no edema. Then I'm gonna check for the radial pulsation. It's okay. Radial pulsation +2 normal rhythm bilaterally. Now I'm gonna check for the branchial pulsation. Branchial pulsation +2 normal rhythm bilaterally. I already checked the femoral artery, so I'm gonna move to the popliteal artery. I want to make sure that we're in there. I'm just gonna move your chair this way a little bit. Thank you. I'm gonna check for the popliteal. Artery. I appreciate the popliteal pulsation +2 normal rhythm bilaterally. Now I'm gonna check for the posterior tibia pulsation. Posterior tibia pulsation +2 normal rhythm bilaterally. Now I'm gonna check for the dorsalis pedis pulsation. Dorsalis pedis pulsation +2 normal rhythm bilaterally. Now I'm gonna check for the cap refill the finger. Capillary refill less than 3 seconds bilaterally upper extremity. Now I'm going to check for the cap refill in the toe. Cap refill the toe bilaterally less than 3 seconds lower extremity. Now I'm going to move to respiratory pulmonary physical exam, okay? Now I'm going to inspect your thorax anteriorly and posteriorly. I appreciate symmetrical raising of the chest anteriorly and posteriorly. I don't appreciate any deformity. And the anterior posterior transverse ratio is 1 to 2. And Bella's respiratory rate is 16 with non-labor, normal rhythm breathing. I don't appreciate any traction, use of accessory, or diaphragmatic breathing. And then I'm gonna inspect for the lips. The lips is pink. The nails, I don't appreciate any nail clumping, cyanosis, tar staining, or humorish. Okay. Now I'm gonna check for the lungs excursion posteriorly. So I'm gonna have you sit on the side of the chair. Second turn easy. Thank you. Right. To check the lung excursion posteriorly around rib, thoracic T10. I'm going to put my thumb between and put some extra skin between. I'm going to ask Bella to inhale deeply for me, please. Thank you. I appreciate the rib cages raised equally bilaterally, and the expansion is about 3 centimeters. Now I'm going to check for the excursion anteriorly. Similarly, I'm going to put my arm around the rib cage with some skin in between. I'm going to ask Bella to inhale deeply. Thank you. I appreciate the rib cage raised bilaterally, equally, and the expansion about 3 centimeters. Next, I'm gonna check for the tactile parameters posteriorly. I'm gonna place them at the bottom of my hand like this, and I'm gonna have Bella to say 99 when my hand moves along. Say 99.
99, 99, 99, 99, 99, 99, 99.
I appreciate the equal vibration bilaterally, and that's the normal healthy fighting. Now I'm gonna check for the tactile parameters anteriorly. I'm gonna put the ball of my hand and say 99 when my hand moves along.
99, 99, 99, 99, 99, 99.
I appreciate the equal vibration and normal intensity bilaterally, anteriorly, and that's the normal and healthy fighting. Next, I'm gonna focus on all the lungs field. I'm gonna place my middle finger on the left hand firmly. I'm gonna avoid the scapula. I appreciate the resonant percussive sound all over the lung field posteriorly. Now I'm gonna percuss the lung fields anteriorly. I'm gonna display the breast tissue. I appreciate the resonant percussive sounds all over the lung fields anteriorly, and that's normal and healthy fighting. Next, I'm gonna check for the diaphragmatic excursion. So I'm gonna expose the skin anteriorly, that's okay?
Yeah.
Posteriorly, sorry. Okay. You can hold right here. I'm gonna have Bella inhale deeply and then hold your breath for a few seconds, okay? Now inhale deeply and hold your breath. Now you can breathe deep, normally. I'm gonna focus until I heard the dullness, and I'm gonna mark that. And now I'm gonna have you exhale completely and hold your breath, okay? Exhale completely, hold your breath. I'm gonna focus upward until I heard the dullness. This is right here. Then I'm gonna measure the diaphragmatic excursion is about 4 centimeters. I'm gonna do similar on the right side, and then the finding should be similar, the same, around 4 centimeters. Then next, I'm gonna auscultate the lung field posteriorly. I'm gonna do it with the diaphragm. I'm gonna start with the apices of the lung. Take a deep breath. Take a deep breath. I appreciate tracheal lung sound over the apices of the lung. Take a deep breath for me. Take a deep breath. Take a deep breath. Deep breath. I'm gonna auscultate in the ladder line pattern and over the first and the second intercostal space. I appreciate the cardiovascular lung sound. Take a deep breath for me. Take a deep breath. Take a deep breath. Take a deep breath. Take a deep breath for me. Take a deep breath. Take a deep breath. Take a deep breath. And all over the peripheral lung field, I appreciate the vesicular sound, and that's normal and healthy fighting. I don't appreciate any advantages lung sound. Now I'm gonna listen for the lungs anteriorly, starting with the opposite of the heart. Take a deep breath for me. Take a deep breath for me. I appreciate the tracheal lung sound over the first area above the clavicular line. Take a deep breath for me. Take a deep breath for me. I appreciate the bronchial lung sound near the sternum area about the first intercostal space. Take a deep breath for me. Take a deep breath. Deep breath for me. Take a deep breath. Take a deep breath for me. Take a deep breath. Take a deep breath for me. Take a deep breath. I appreciate vesicular lung sound all over peripheral lung field, and that's normal fighting. I don't appreciate any advantages lung sound upon my examination. Next, I'm gonna do the test, bronchophony. I'm gonna auscultate over the lungs field and have Bella say 99 as my theroscope moves along. Say 99 when you see my theroscope, okay? 99.
99. 99, 99, 99, 99, 99, 99, 99, 99, 99.
I appreciate the clear, vibrating sounds. So it means there's no consolidation in the heart, and that's normal and healthy fighting. I'm gonna do the test anteriorly in the similar ladder-like pattern, and say 99 with my stethoscope. Move along.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
I appreciate clear, vibrating sounds when Baba say 99. So it means there's no consolidation within the lung field, and that's the normal and healthy fighting. Alright, Bella, we are done with the cardiovascular and pulmonary assessment. Do you have any question for me?
No.
Okay, I'm gonna upload all the results in your patient portal. If you have any question, send me a message or call my clinic, okay?
Thank you.
Thank you, have a good one.
Thank you.